Hello everyone. In this INR number 90, I am going to tell you about mantle cell lymphoma. Right? So, what is mantle cell lymphoma? It is a mature B cell type of tumor. Remember, this is a mature B cell type of tumor, and their origin is from the mantle zone of the lymph node. So, who will be commonly affected? Male beyond the 60 years. So, these are older individual who will be affected, and most common presentation will be painless cervical lymph node enlargement. Right? So, painless cervical lymph node enlargement will be the most common presentation, but they have one more thing that is called as characteristic presentation. So what is characteristic presentation? They will be having lymphomatoid polyposis. Remember, this is very important PYQ. Lymphomatoid polyposis is a pattern of spread seen characteristically in which lymphoma? So answer will be mantle cell lymphoma, right? Lymphomatoid polyposis. Why? Because tumor cells are infiltrating into the intestinal mucosa. So tumor cells are infiltrating into the intestinal mucosa, and that is called as lymphomatoid polyposis. So now you can see this is the lymphomatoid polyposis, right? So lymphomatoid polyposis, you will see there is a polyp-like appearance on gross examination, and this is the endoscopic examination. We are seeing so many lymphomatoid polyps, right? So these are all having tumors, and tumors are making them polypoidal in appearance, right? When you will see the microscopy, you will find there is a neoplastic lymphoid cell surrounding a small atrophic germinal center and producing a mantle zone pattern of the growth. So now you can see this is the small atrophic germinal center, right? A small atrophic germinal center, and surrounding them you can see all these are the neoplastic tumor cell from here to here. All small round tumor cells are neoplastic tumor cells, and they are resembling like a mantle zone of the lymph node. That is why it is mantle cell lymphoma. When you will see them on high power view, you will see the cells like this. So all these are neoplastic cells. So they are homogeneous population of a small lymphoid cell. So they are all similar looking lymphoid cells with regular nuclear outline. So nuclear outline is regular, and condensed chromatin. So you can see condensed chromatin is present, right? So you can see condensed chromatin is present, and scanty cytoplasm. That is why you are seeing only the nucleus. The cytoplasm is very scanty or very less, right? So that is the presentation of the mantle cell lymphoma on lymph node biopsy. So how we can diagnose? So we can diagnose mantle cell lymphoma by immunophenotyping and by cytogenetics. So by immunophenotyping, if you remember, they are mature B cell type, and they are arising from the mantle zone. Because they are arising from the mantle zone, so they will be CD5 positive, even though they are B cell type. Remember, even though they are B cell type, but CD23 will be negative. That B cell marker will be negative. Even though they are B cell, but T cell marker is positive, because CD5 is a marker of the mantle zone from where tumor is arising. So that is why immunophenotyping, CD5 is positive, 23 is negative. On cytogenetic analysis, you will find translocation 11 to 14 will be present in the cytogenetics of the mantle cell lymphoma. So why this translocation 11 to 14? Because of the cyclin D1, which is present on chromosome number 11. So this cyclin D1, also called as BCL1 overexpression, can be present in the mantle cell lymphoma. So cyclin D1 or BCL1 overexpression will be seen in mantle cell lymphoma, and this is very important PYQ. Translocation 11, 14 or cyclin D1. Sometime what happens, this cyclin D1 is negative. And when they are negative, what will happen? What is the best marker to confirm is the SOX11. So if examiner says that what is the best marker for the diagnosis, so best marker for the diagnosis of mantle cell lymphoma will be SOX11, right? So that is what you need to remember. So what cytogenetic changes we are going to use for diagnosis? Translocation 11-14, cyclin D1 or BCL1 overexpression, and when these are things negative, then we can use SOX11, right? So SOX11 is the question which came three times in the INICT exam and one time in the DNB exam. So just remember, the examiner can repeat this question in your exam. So keep revising your topic, and you will get question from here. Best wishes for your